What is blood pressure? Blood pressure is your blood circulation, which is the force of the blood flowing through your blood vessels. Two values from a blood pressure test are obtained. Systolic blood pressure, which appears as the top number, gauges the force exerted by your heart as it beats and pushes blood through your blood arteries. The diastolic blood pressure, which is represented by the lower value, gauges the pressure created when your blood vessels relax in between heartbeats. Every time a diabetic patient sees their healthcare practitioner, their blood pressure should be monitored. The key to maintaining good cardiovascular health. Blood pressure is a vital sign of our cardiovascular health and is essential to maintaining the health of our bodies. It is frequently referred to as the silent killer, and if unchecked, it can have disastrous effects. The fundamentals of blood pressure, its measurement, factors that affect it, and the significance of maintaining a healthy blood pressure level will all be covered in this article. What is blood pressure? Blood pressure is the force that blood applies to artery walls as it is pumped through the circulatory system. It is usually expressed in millimeters of mercury, mmHg, and is represented by the systolic pressure multiplied by the diastolic pressure. For example, a result of 120 over 80 mmHg indicates a 120 systolic and 80 diastolic blood pressure. Systolic pressure. The higher number, or systolic pressure, indicates the pressure in the arteries when the heart beats or contracts, pumping blood into the body. Diastolic pressure. This is the lower number, indicating the pressure in the arteries between heartbeats when the heart is at rest. Knowing what normal blood pressure is. Normal blood pressure is usually measured as 120 over 80 mmHg. However, blood pressure can vary between people based on things like age, sex, general health, and lifestyle. Blood pressure generally tends to increase with age due to things like hardening arteries and lower elasticity. Blood pressure, the silent killer. The condition of hypertension, also referred to as high blood pressure, is characterized by a consistently high blood pressure against the arterial walls. Because it frequently shows no symptoms, it is known as the silent killer. Hypertension can have serious health problems like heart disease, stroke, kidney damage, and vision loss. If it is not treated or controlled, diet, a high sodium fat, saturated fat, and cholesterol diet may be a factor in the development of hypertension. On the other hand, a diet high in fruit, vegetables, whole grains, and lean meats can help support maintaining healthy blood pressure levels. Exercise regularly is essential for managing blood pressure. Physical activities such as brisk walking, swimming, or cycling can help control blood pressure. Weight. Being overweight or obese increases the chance of developing hypertension and puts additional stress on the heart. Losing weight with a balanced diet and regular exercise can lower blood pressure. Alcohol and tobacco, both smoking and binge drinking, can cause blood pressure to increase. Reducing alcohol consumption and quitting smoking can both lower blood pressure. Chronic stress can increase blood pressure. Adopting stress reduction practices like mindfulness, yoga, or medication can be beneficial.